We have the pleasure of having Professor Svetlana Popova over. She's got so many accolades, but I'm going to go through a few of them. She's MD, PhDs, MPH, Senior Scientist at CMH's Institute for Mental Health Policy Research. She's also an Associate Professor at the Dalai Lama School of Public Health. She has an appointment as a Graduate Faculty Associate Member with the Institute of Medical Science at University of Toronto. She has a national and global presence as a researcher in the field of mental health and addiction, particularly fetal alcohol spectrum disorders, which are recognized as the leading known preventable cause of developmental delay and intellectual disability among Canadians. Her research focuses on the epidemiology, economic cost, prevention, and intervention strategies related to FASD. And she's here to talk about global prevalence of prenatal alcohol consumption and fetal alcohol spectrum disorder. Please make her welcome.
Should I open this or not? Thank you so much, Dr. Lash, for your very kind introduction. Good afternoon, everyone. I am very pleased to be here today and very honored to be chosen as a plenary speaking at this very important event. I also would like to thank the organizers of this conference for the opportunity to be here for me today in such a beautiful country and present the results of our recently conducted studies at the Center for Addiction and Mental Health in Toronto, Canada. So my story is my data, or data of our team. I will tell you my story through our research. So today I will be talking about prevalence of alcohol consumption among women of childbearing age in the world. I will also present the prevalence of alcohol consumption and binge drinking, as well as prevalence of FAS and FASD in different populations in different countries, including countries of Australia and New Zealand, as well as by World Health Organization regions and globally. Then I will present some data on comorbidity and economic cost. And finally, I will briefly outline the World Health Organization Global Prevalence Study on FASD. Alcohol can cause more than 200 disease conditions and very serious disease conditions such as cancers, cardiovascular diseases, injuries, intentional, unintentional. And according to the recent World Health Organization Global Status Report on Alcohol and Health, alcohol contributes to 5.3% of all deaths worldwide. And this is greater than deaths caused by HIV, AIDS, violence, and tuberculosis together. We all know that alcohol is associated with many serious social issues such as violence, child neglect and abuse, absenteeism, law enforcement problems. And our team estimated that costs associated with alcohol abuse, including cost of mortality, morbidity, law enforcement problems, is approximately $15 billion per year in Canada. But we know that alcohol can cause harm not only to the drinker, but harm to others. For example, drunk driver kills pedestrians, drunk father abuses his children. But FASD is the most traumatic harm to others. And of course, this harm is unintentional because no mother in the world would want to harm her unborn child. We specifically created these maps for this conference based on the most recent World Health Organization data for 2016, and this data is not published anywhere yet. So let's review how women of childbearing age consume alcohol in the world. This is percentage of current drinker drinkers, which means women who consumed alcoholic beverages in the previous 12 months among childbearing age from 15 to 49. The darker the color, the higher the prevalence. So you probably can easily spot two places. The first one is European region, and second one, Western Pacific region, Australia and New Zealand. So the percentage of current drinkers is over 65.6%. The second highest is in Americas, in North and South America, as well as in Central and Eastern Europe. The prevalence is between 56.4 to 65.6%. The lowest prevalence is in Eastern Mediterranean region and in some countries in African region. And majority of the population is in these regions of Muslim faith, the religion is associated with very high abstention rates. The next slide shows alcohol per capita consumption among childbearing age women in liters of pure alcohol per person. And again, you can see that the highest prevalence is in European region, over 5.2 liters of pure alcohol per woman. The second highest in Americas, Western Pacific region, some African countries, and the prevalence is between 4.1 to 5.2 liters. And again, the lowest prevalence in Eastern Pacific region and some Muslim countries of Africa and in Southeast region. And the prevalence is lower than 0.2 liters. So in overall alcohol consumption and binge drinking among childbearing age women, and especially among young women, is increasing in many countries, including the most populous countries of the world, such as China and India. That's why in the near future, we expect more alcohol-related problems, health problems, as well as increased rate of FAS and FASD if we do nothing. Now, let's see what is the prevalence of alcohol use during pregnancy and FAS and FASD in the world. Our team recently conducted several studies which were published in the high-impact journals such as Lancet, the Lancet Global Health, JAMA Pediatrics. We conducted a comprehensive literature review which was not limited geographically or by language. And for countries with 2 or more studies, we conducted meta-analysis in order to produce pooled estimate based on available data. But for countries with no data or only with 1 study, we predicted these estimates. So basically, we provided all countries with these indicators, exactly 186 countries with actual or predicted estimates. On this slide, you can see the prevalence of alcohol use during pregnancy in general population for select countries. And the highest prevalence was observed in Ireland, 60%, Belarus, 47%, Denmark, 46%, UK, 42%, and Russia, about 37%. And you can see that all these countries belong to WHO European region. However, if you look at the prevalence in the countries from other parts of the world, you will see that quite a large proportion of pregnant women consume alcohol. For example, in Australia, it's 37%, in New Zealand, it's about 27%, in Zambia, 19%, in Brazil and United States, about 15%, and in Canada, it's about 10%. So I'm slow. This slide shows prevalence of alcohol use during pregnancy in general population by World Health Organization regions, and there are 6 World Health Organization regions. The highest prevalence of alcohol use was in Eastern European region, 25%, followed by Americas, 11%, African region, 10%, Western Pacific region, 8.6%, Southeast Asia region, 1.8%, and the lowest prevalence, again, was estimated for Eastern Mediterranean region. It's going slowly. Eastern Mediterranean region, 0.2%. Again, the reason because majority of the population of Muslim faith with a very high rates of abstention from alcohol. This slide presents the same data on the prevalence of alcohol use and binge drinking, defined as 4+ drinks per occasion during pregnancy in general population. And again, you can see that the highest prevalence is in Europe, 25%, and the lowest in Eastern Mediterranean region, 0.2%. But in terms of binge drinking, the highest prevalence was observed in African region, 3.1%, followed by Americas, 2.8%, European region, 2.7%, and Eastern Mediterranean, Pacific region, 1.8%, and the lowest was observed in Eastern Mediterranean region. Worldwide, we estimated that the prevalence of alcohol consumption among general population is about 10%, which means that 1 out of 10 pregnant women consume alcohol in the world, and 20% of them consume alcohol in binges during pregnancy, which is very alarming because this is the direct cause of FIS and FSD. Next slide presents 5 countries with the highest prevalence of binge drinking during pregnancy in general population. About 10% of pregnant women reported binge drinking in Ireland, Czech Republic, Moldova, Lithuania, and a little bit higher in Uruguay, 14%. But proportionally, the highest proportion of women who binge drank during pregnancy out of all women who used any amount of alcohol during pregnancy was the highest in Paraguay, 78%, followed by Lithuania, 42%, Moldova, 36%, Czech Republic, 26%, and Ireland, 17%. Next slide presents prevalence of any amount of alcohol use during pregnancy in general population of Australia. Dr. Elliott has outlined epidemiological data in her presentation today, and if I may, I will just reiterate these findings. From the world literature, we identified 21 studies from Australia, which reported prevalence of alcohol use during pregnancy. And you can see that the prevalence ranges from 7.5% to 76.6%. And based on this data, we estimated pooled prevalence via meta-analysis, and the pooled prevalence is 35.6%, and it's approximately 3.6 times higher as the global average, 10%. And because we did search up to 2015, on the bottom of the slide, you can see a couple of studies which appear after year of 2015 in Australia. So next slide shows prevalence data of any amount of alcohol used during pregnancy in general population of New Zealand. And we identified only 6 studies, and the prevalence was ranging from 13% to 42%. And our meta-analyzed estimate is about 27%, which is approximately 2.7 times higher than global average of 10%. This slide presents the prevalence of any amount of alcohol use and binge drinking during pregnancy in WHO Western Pacific region. There are 21 studies, and you can see that Australia and New Zealand have highest prevalence among all these countries. However, which was very interesting, proportion of binge drinking was the lowest in these countries. You can see that in Australia it's 6.7%, and in New Zealand it's even lower, 3%. And the highest proportion of binge drinking during pregnancy was observed in, if I can show you, was observed in Brunei Darussalam, 50%, and the second highest was in Mongolia, 41%. Only 5 countries in Western Pacific region have the prevalence lower than the global average of 10%. Now I am moving on prevalence of FASD and FAS in general population. And this is our flow chart for systematic literature search. We identified only 19 studies, 62 studies from only 19 countries, which met our very strict inclusion and exclusion criteria. Majority of the studies were from the United States, 24 studies, and second was South Africa, 9 studies. In Australia, we identified 7 studies, and in New Zealand, 1 study. And this is again a map of the prevalence of FAS in general population by World Health Organization regions. And in line with the prevalence of alcohol use during pregnancy, the prevalence of FAS again was the highest in European region, 37.4 per 10,000 people, followed by Americas, 16.6 per 10,000, African region, 14.8, Western Pacific region, 12.7, Southeast Asia region, 2.7, and the lowest was observed in Eastern Mediterranean region, 0.2 per 10,000, almost 0 cases. This slide presents prevalence of FAS, FSD, I cannot see it, sorry. FAS, prevalence FAS in general population, that's right? Yes, globally we estimated that prevalence of FASD is 14.6 per 10,000, which is equivalent of 0.15%. And next slide presents prevalence of FASD. And again, the highest prevalence was in European region, around 2%, the lowest in Eastern Mediterranean region, 1.3 per 10,000, and globally we estimated that prevalence of FSD is about 0.77%. This slide shows 5 countries with the highest prevalence of FSD in the general population, and the highest was observed in South Africa, approximately 11%, Croatia, 5.3%, Ireland, 4.8%, Italy, 4.5%, and Belarus, 3.7%. And this is a prevalence studies of FS and FSD per 10,000 population in Australia. We found 7 published studies on the prevalence of FAS in general population, and based on these studies, we estimated that the prevalence of FAS is 2.4 per 10,000, which is much lower as compared to global average of 14.6. We also estimated prevalence of FSD based on only 2 available studies, and the prevalence is 6 per 10,000, which is also much lower than the global average of 77.3 per 10,000. In order to understand true prevalence of FSD, we have to look at special populations because this prevalence is very different what we see in the general population. So we compared, based on some select studies, prevalence of special populations with the global average, 7.73. As compared to the global average, the prevalence of FSD among children in care was from 5 to 68 times higher as compared to the global average. Prevalence among Aboriginal populations based on Australian and Canadian studies was from 16 to 25 times higher. Prevalence among psychiatric care population was approximately 19 times higher. Prevalence among low socioeconomic status population was approximately 24 times higher. And prevalence in correctional population was about 30 times higher. And this is data on existing studies on FSD prevalence in special populations of Australia, which Professor Elliott have already presented. So there are one recent study by Dr. Bover and colleagues which estimated 36.4% of youth with FSD in detention center. And 4 studies reported prevalence of FSD in Aboriginal populations. The most recent study by Dr. Fitzpatrick estimated about 19% of people with FSD, but other studies reported much lower rates of FSD, 0.4%, 0.5%, and 1.5%. Now I would like to show you some data on comorbidities of FSD. We all know that FSD associated with many comorbidities, physical and mental disorders due to permanent damage of prenatal exposure on the fetus. However, what we did not know is how many diseases, what type of diseases, and with what frequencies they occur in individuals with FSD. So again, we conducted a comprehensive literature review and analysis. We looked at all medical and epidemiological literature, and we identified a list of comorbid conditions. We also estimated pool prevalence of these comorbid conditions, which found to occur among people with FAS. And this is our systematic literature review. You can see a flow chart. You can see that we identified more than 5,000 records, but after all steps, only 127 studies were included in our qualitative synthesis, and 33 studies were included in our meta-analysis. And based on this available data, we found that 428 comorbid conditions spanning across 18 out of 22 chapters of International Classification of Diseases were seen in people with FSD. And the most prevalent disease conditions were congenital malformations, deformities, and chromosomal abnormalities. And the second highest prevalent group of disorders were mental and behavioral disorders, which accounted for 19%. Among other groups of disease conditions, you can see on the slide, are diseases of the eye, ear, neoplasms, diseases of the nervous system, circulatory, respiratory, digestive, musculoskeletal, genitourinary systems, diseases of the skin, and many others. So this is a solid evidence that prenatal alcohol exposure can affect any organs and any systems of the fetus. Based on 33 studies, which reported data on frequency of at least one disease conditions, we were eligible for inclusion in our meta-analysis, and these studies contain over 1,700 subjects with diagnosed FAS. And based on this data, we identified the comorbid conditions which with a pooled prevalence over 50% among people with FAS. The highest pooled prevalence of comorbid conditions was observed in group of mental and behavioral disorders, red bars. Conduct behavioral problems was estimated to be about 90% among people with FAS, followed by receptive and expressive language deficit, about 80%. Developmental cognitive disorder and speech-language delay are both close to 70%. Alcohol and drug dependence as a secondary disability, about 55%. And attention deficit hyperactivity disorder, about 50%. The second largest group of diseases is diseases of the eye, which consisted of refractive errors slightly above 70%, and visual impairment above 60%. The third largest group is diseases of the ear, yellow bars. Chronic and acute otitis media. Chronic is about 80%, and acute form is about 50%. Central hearing disorder and conductive hearing loss are both about 55%. Among conditions originating in perinatal period, green bars, are intrauterine growth retardation, about 70%, and premature birth, 65%. Next one is congenital malformations, also very prevalent, about 50%. For example, cervical spine fusion and hypertelorism. So these results clearly demonstrate that a large spectrum of diseases is extremely prevalent among people with FAS. We also were able to compare the pooled prevalence of some selected diseases among people with FAS and among the general population of the United States. We choose the population of the United States because the majority of the subjects in our studies were from United States population. And you can see here that conduct disorder and receptive language deficit disorder among individuals with FAS was estimated to be about 10 times higher than among the general population of the United States. Chronic otitis media is 77 times higher. Expressive language disorder, 11 times higher. Disorder of psychological development, 98 times higher. Preterm infants, 5.6 times higher. Visual impairment, including blindness, 31 times higher. Hearing loss, about 126 times higher. Alcohol and drug dependence, 4.4 times higher. Disturbance of activity and attention, 7.6 times higher. So this data clearly demonstrate that the prevalence of some disease conditions are enormously higher among people with FAS as compared to the general populations. I also wanted to show you our data on economic cost of FASD. Based on the burden associated with FASD, it's not surprisingly that the annual cost due to FASD is enormously high for any society. And our team estimated that annual cost for Canada ranges from 1.3 to 2.3 billion Canadian dollars per year. And we still believe that this cost is severely underestimated because of the data unavailability. And secondly, these estimates were produced based on the assumption that FASD prevalence in Canada is 1%, but now we know that it's much higher, so the cost probably will be double, maybe even triple. And you can see here that the highest contributor to the overall FASD attributable cost is the indirect cost of productivity losses due to disability and premature mortality of people with FASD, which accounted for 42% of the total cost. And the second highest cost is direct cost of corrections, which accounted for 30%. And third highest cost contributor is the cost of healthcare. However, when I present this cost, I'm very careful because these cost estimates, they are certainly very helpful to present to policymakers and decision makers. because it's really clear for them how much burden exist in the country. However, these cost figures should not further stigmatize mothers with children with FSD and families with FSD. Instead, these cost figures should be used as solid scientific evidence in order to fight for support of these families and these mothers and kids. So based on observed epidemiological data, it's clear that data on the prevalence of maternal alcohol consumption and FSD are completely absent for the majority of the countries in the world. However, in order to understand severity and impact of FSD in the world, we have to know how many people exist in each country. Therefore, it was a call from a World Health Organization to initiate study on the global prevalence of FSD. And this study is currently in place, guided by World Health Organization with support from National Institute on Alcohol Abuse and Alcoholism. The objective of the study is to estimate the prevalence of FSD among children from 7 to 9 years of age using an active case ascertainment approach, which means that researchers are actively seeking out and finding cases in the general population. As of now, there are several countries which are participating in this large study. Countries from Central and Eastern Europe, African countries, and Canada. In Canada, we recently completed this study and published the report. And as a collaborating center of World Health Organization, where I'm working, our team is responsible for support from all involved countries in this project, and I'm the principal investigator. This is a very brief schema of our data collection process. There are two phases of data collection. In the first phase, which is pre-screening stage, we physically go to schools or other institutions and assess consented children on physical status. We're measuring height, weight, head circumference, and we also take behavioral and learning difficulties history from teachers and or caregivers. And then those children who met criteria with a growth deficit, with small head circumferences, with behavioral or learning problems, they are moving to the next stage, active case ascertainment itself, for this morphological assessment and neurodevelopmental assessment. And mothers of children with suspected FSD are invited for interview. And of course, our major goal is to get a history on prenatal alcohol exposure and other exposures, but we also assess mothers on many other risk factors. That's how we estimate prevalence in this study. And very briefly, if I may, as I said, we completed prevalence study in Canada based on this methodology, and we found that the prevalence in general population among elementary school children is ranges between 2% and 3%. And this estimate is double or even possibly tripled previous crude estimates of 1%. And what is important here is that FSD prevalence, which we estimated, exceeds that of other common birth defects, such as Down's syndrome, spina bifida, trisomy 18, as well as spectrum disorder, autism spectrum disorder in Canada, which is about 1%. So to conclude, FSD is prevalent and alcohol-related neurodevelopmental disability globally. However, FSD is preventable. That's why it's so important to establish a universal public health message about detrimental consequences of alcohol around the globe, establish routine screening protocols, not only for pregnant, but for women of childbearing age, provide brief interventions where appropriate to all pregnant women and women of childbearing age, and we should pay special attention to high-risk populations, special populations, where the impact of FSD is especially severe. Thank you so much for your attention. But if I may, I would like to make very brief announcement. So you can find these flyers in FSD booth stand on this floor. International Journal of Environmental Research and Public Health having a special issue on fetal alcohol spectrum disorder. And my colleague, Dr. Larry Bird, and myself, we are guest editors of this issue, and we accept papers by the end of April of 2019. So please submit your research for peer review. It's a great opportunity for publication. Thank you so much again.